over to California. That has become the first state to formally shift to an endemic approach to the virus. Now, Governor Gavin Newsom unveiled a plan last week that emphasizes prevention and quick reaction to outbreaks over mandates, masking, and business shutdowns. So let's get to an expert. We're joined now by Dr. Chris Colbert. He is Assistant Program Director of Emergency Medicine Residency at the University of Illinois. Dr. Colbert, always a pleasure. So let's start with California, right? Infection rates are down there. California just one of many states turning the page on the virus. As a healthcare professional, are we moving too far ahead of ourselves? Do you think we should slow things down, or it's the appropriate timing?
There's a lot to unpackage with that question, Tashani. I
Yeah.
think that things have to go into perspective. Number one, where you are in your location and resources and the numbers of where you live make a huge, huge difference. And also the government structure. The thing about California, I think everyone needs to be turning the page and preparing for the future for their community. And I think it's great that California is taking those steps in transitioning from a pandemic to an endemic and identifying those resources and making plans to ensure that their new normal is safe for everyone and encourages returning to regular lifestyle and also the economy as well.
Yeah. For folks at home, let them know what that means, right? From pandemic to endemic. What exactly does that mean?
So that's perfect. So when you're transitioning from a pandemic to endemic, it's by definition, a pandemic is in any sort of infection process that transitions from different continents or countries, where an endemic is any sort of concern such as a virus, usually a virus that is located at a specific area and it's manageable. The outbreaks and or the health burden from that specific virus is managed, and there is something we can hold to ensure that the outcome are not as devastating of the effects as they were before.
Yeah. Dr. Colbert, excuse me. Um, Folks are tired. And I say that, not TIRED, but tired. They are. I mean, do you think COVID fatigue is possibly behind some of these decisions?
100%. 100% there's COVID fatigue. And I can't tell you how many times I'm humbled when individuals come to me as an ER physician and say, I'm tired of COVID. And I want to respond, tell
Yeah.
me all about it. For the last 2 years, doctors have diagnosed, admitted, called the time of death on COVID patients, and I've done this for the past 2 years. And 100% I agree that everyone is tired of COVID. However, my recommendation is always to adhere to recommendations that are passed by the CDC. And there's a lot of different conversation with that as well, because in order for all of us to move forward, we honestly have to make a collective effort to do so. And it sounds very cliche. And also it's like you're playing their broken record again. But for us to move ahead, like California's doing, you have to have a collective conversation and goals and expectations for your community. That includes masking, removing the mask now, because the numbers are looking good, and also vaccinations.
Yeah. Dr. Colbert, since you brought it up, being tired, I mean, how are you, sir? 2 years into this pandemic.
Well, you know what? There's a silver lining on the cloud of COVID. There has been a lot more conversation in reference to wellness for physicians, wellness for family members, mental wellness, prepared for, and just having the conversation of public health. There has never been a time in history where there's been so much discussion on public health. And that's extremely encouraging, because if anything happens in the immediate future, we have a point of reference of these moments with COVID where we're learning, where we can transition and move forward, because now there's a discussion not only in reference to medicine, in reference to individuals, but how this affects schools, businesses. And now that we've had this really good conversation, we can move forward and again, transitioning from pandemic to endemic, which is a perfect segue of how we can move better and forward as a community.
Yeah. Well, speaking of public health, you're in Chicago with a large Black population. Uh, you know better than anyone how this pandemic has disproportionately impacted Black folks. What are you seeing on the ground now?
To give some context, which is a great question, to give some context, it's social determinants of health. Now, social determinants of health are aspects out of health, such as education, resources to transportation, jobs, that contribute to 80% of health outcome. 80%. So just your zip code alone can give insight on the resources you have with health, as well as the probability of those individuals in health outcome. So what we have seen just across the globe in reference to specifically Black and Brown patients is that there is a higher disproportionate amount of individuals that have succumbed to COVID as opposed to other individuals, specifically Black and Brown patients. And when you look at the grand scheme of this, and you can identify things such as access to transportation, that individuals, specifically in Black and Brown communities, work in or live next to hospitals that only have 4 ICU beds, 7 ICU beds, where the stay in the ER was longer than that of other hospitals. It just put things in the forefront and puts us in a position of greater conversation so we can address these concerns to have better outcome and patient outcome for Black and Brown patients.
Yeah, you spoke of social determinants, right? Let's talk about, multi-generational households, which a lot of Black and Brown folk live in. Talk about the risk that remains for kids who are unable to be vaccinated.
So that's an excellent question as well. And there's a lot to unpackage with that. But just to give some context as well, what we identified specifically in the emergency room, because in the ER, everyone comes to the ER. We take all comers. It's a 24-hour, 7-day-a-week gig. No holidays off, no weekends off. But with that, we have the gift of looking at everything from the ground floor and can engage in conversations in reference to things such as what you've discussed and identify ways which we can move forward and better. One thing that we identified specifically with multi-generational households is that usually those families were essential workers, i.e., everyone in the family worked at the airport. Everyone in the family worked at the bus station. And that means they had to go to work. They didn't have the resources to not take public transportation to the airport, and the airports didn't close. The bus stations didn't close. So again, a higher proportion of those individuals succumb to COVID. So that in and of itself put into position a better conversation of how we can address public health issues and specifically tailor it to different populations.
All right, Dr. Colbert, my last question for you, right? I want to know, can we expect, as we move forward, if we get out of this pandemic, right? If we get another surge, another variant on the horizon, will we be prepared? And I know you don't have a crystal ball.
The key aspect, which is fair, totally fair, but it's still a common question that I get. So again, fair play. But here's the thing. The key aspect of success of this pandemic is human behavior. It's not the fact that there was a Spanish flu or a Russian flu hundreds of years ago, but now we have a coronavirus pandemic or flu that we have a vaccine for. If individuals receive the vaccine, we would not have hospitals busting at the seams. So we've had Delta variant, we've had Omicron variant, and it's very important for everyone to not overlook the fact that before Delta, our numbers were low. Before Omicron, our hospital numbers were ridiculously low. It's my hope that as a community, we look back at these moments, we look back at Omicron, we look back at Delta, and when there is another variant, which it will be, I have no idea the degree of pathogenicity of this variant, but it's my hope that we can learn from the past decisions we've made so that we can move forward as a community and still engage in our regular activities and limit the amount of mitigation because we're adhering to medical recommendations and policy.
All right, Dr. Chris Colbert coming to us live out of Chi-Town. We appreciate your expertise, sir, and your time. Thanks for being with us.